I'll talk a little bit from the Board of Health side for a bit after that, what we as the commissioners and Board of Health have been looking at, and then we will roll through the other presenters and then take Q&A. So I think we're scheduled for about an hour, so I won't take any more time. So we got plenty of time for questions. So with that, Dwayne, I'd pass it over to you.
Thank you, Commissioner. Good evening, everyone. Dwayne Smith with Elbert County Public Health. Thank you for joining us tonight. Currently, our confirmed number of cases since the inception of the virus exposure in Elbert County stands at 44. Please note that this figure does not represent the number of active cases, but rather a cumulative frequency count of the number of confirmed cases. Statewide surveillance of cases, including a variety of metrics, are updated daily. And after I'm through talking, I will put in the chat box the website from the state of Colorado that I would encourage everyone to take a look at when they have a moment so they can get a good understanding of where the state sits, both in frequency counts and geography and things of that nature. Some good news to share that as of yesterday, the statewide growth rate for the virus is down to 0.9%. This is the first time the daily growth rate in cases has been below a 1% day over day rate of growth. So that is good progress. Daily hospitalizations are back down to a 0.1% growth rate as well. Yesterday, Colorado also hit a milestone in reaching a daily testing record. I should say last week, not yesterday. Last week, 4,500 tests were done in one of the days last week. So that is a significant accomplishment. There's still room to expand that. The state would see, and the CDC would like to see Colorado have somewhere in the neighborhood of 6,500 to 7,500 tests done per day. We are expanding our statewide resources for testing, including the first testing location in Elbert County at the Peak Vista Community Health Center in Kiowa. That began last week through a partnership between the county and Peak Vista, and we're very excited to have that resource available for citizens. That clinic is located in downtown Kiowa at 320 Comanche Street. They are open Tuesday through Friday from 8 a.m. to 5 p.m. Current testing protocols from the CDC dictate that only those folks that are experiencing COVID-19 symptoms should be tested. That will be relaxed over time once some of the supply chains continue to ease up and more testing resources are available for communities. However, if you call the Peak Vista Clinic and they're going to screen you with some questions. For example, have you been in contact with anyone that's tested positive for the coronavirus? Or do you feel like you've been exposed, or some of our variety of other questions? Several of our cases, of our total of 44, perhaps as many as, certainly as many as 8, maybe a few more, have been in the same family. So if a family member in your same household is tested positive, we certainly want folks to, the rest of the household, to get tested as well. Peak Vista can be reached at 720-389-9763. I will also post that in the chat box. From a general perspective, know that Colorado has a Medicaid nurse line. If you're feeling sick for any reason, COVID-19 or otherwise, please call the nurse line at 800-283-3221. And also with regard to your mental health, we want to make sure that folks are aware of Colorado Crisis Services and the resources that they have available. You can call 844-493-TALK. That's 844-493-8255 on the phone keypad, or you can text TALK to 38255. 38255. We understand that everyone's been under a great deal of mental stress through the stay-at-home and now the safer-at-home period. And we want to make sure that folks are taking care of not only their physical well-being, but their mental well-being. So now we are in the safer-at-home period of our statewide response to the COVID-19 epidemic. You're well-versed in what the stay-at-home situation looked like. We will most likely be in the safer-at-home phase for many months to come. We will most likely not emerge. We won't emerge from the safer-at-home phase until the data dictates that it is safe to do so. The next phase will be called or known as Protect Your Neighbor. A quick overview of safer-at-home. What does that mean? I mean, stay at home as much as possible. Wear a face covering or mask when you leave your home, even when you're outdoors. Critical businesses are still open, albeit with some restrictions, including social distancing. Some non-critical businesses are open with restrictions. Always practice good hygiene, wash your hands frequently, don't touch your face, which many of you may find, including myself, is the hardest thing to do throughout the day, particularly if you're sitting at a desk or in front of a computer monitor. And please connect with neighbors and loved ones electronically or virtually through many of the apps that are available out there. And let's see, I just need to adjust something here so I can see the slide. Okay, moving on to Elbert County's request for a partial waiver from the safer-at-home state orders. We have submitted a request that was submitted on May 4th. We were lacking a document, basically an endorsement from a local hospital. We received that endorsement from Parker Adventist Hospital. An endorsement is probably not the best word, an attestation that should there be an uptick in the number of COVID infections among Elbert County residents, that Parker Adventist Hospital would not be overwhelmed in treating patients from Elbert County, as well as treating their normal volume of patients. Why that hospital? I believe Chief Steck will probably elucidate that a little bit later on, but when Elbert County residents need acute care or hospitalization, that's the hospital that they are most frequently taken care of at. The partial waiver request to CDPHE that is in the queue with several other, as many as we believe, probably 16 at this point, perhaps more, 16 other counties that have requested partial waivers from the Safer at Home executive order and the accompanying public health order from CDPHE. We're told that there's currently a 4 to 5 day turnaround on notification of that request. The possibility exists that CDPHE may come back and say, we'd like you to expand a little bit more on this particular component of the application, or you've had a recent uptick, and I'm speaking generally of all counties, not specifically to Elbert County. You had a recent uptick in the number of cases. Let's monitor it for another week and see what the data says. We understand that CDPHE is being very judicious with the approvals for the waivers, which is certainly understandable. We are, to a significant degree, finding our way, not only in Elbert County or Colorado, but the nation as a whole, and trying to identify how best to ease restrictions using evidence-based approaches and letting the data drive our decision. But the reality is, in whatever format we come out of this, we're going to see spikes here and there in the data, especially as we get more folks tested in the county. Naturally, the more folks we test, the more positive cases we're going to find. That's not as significant a concern as some of the situations we encountered a month ago, or certainly 2 months ago. but we still need to preserve the healthcare safety net, the first responder ability to treat those folks in the pre-hospital environment. So throughout all this, we will strive to keep the community and the county and citizens and everyone else informed. And certainly if you have specific questions, you can reach out to me at the health department, and I will do my best to provide an answer. A lot of the questions we get are asking or looking for interpretations of the executive order or the public health order. We get a few calls from concerned citizens sharing that businesses are maybe not doing all they potentially can to protect shoppers and their own employee workforce. We follow up on those with first a phone call and offer our support and try to answer any questions and hope that that situation can be resolved amicably. I mentioned the Peak Vista Community Health Clinic testing location. It is critically important for us to have many points of data to allow for local decision making, particularly as it relates to a rural public health perspective. A lot of the guidance and rules that are being promulgated are coming from the state level and from metro Denver area, larger health departments. We want to make sure that the decisions that we make are in the best interests of our residents, of our businesses, of our economy, and the general health and welfare of the community. So one of the most important metrics that we hope to gain progressively more data on is the percentage of people that get tested, what percentage are testing positive for the virus. Ideally, we want less than 5%. Well, ideally, we want 0% of the tests to come back positive, right? Reality is what we're striving for is 5% or less of everyone that gets tested comes back positive. The lower that is, obviously, the better. So again, we want to make sure people know that there is a testing resource available. There are also testing locations outside of Elbert County, and we encourage folks to certainly take advantage of those. If, for example, they work in a neighboring county and it's more convenient to go to one of those testing sites, please do so. And hopefully everyone is aware of the symptoms of the coronavirus. If you're not, in the interest of time, just Google that and you'll see those real quick. Current data in Elbert County. Eileen, can you move to the next slide, please? So this bar graph, in essence, illustrates that we've averaged less than one case of virus infection, one confirmed case of the virus infection per day since the inception of the epidemic in March. That's really good. Of course, we don't yet know or have a valid and reliable testing mechanism to identify who may have had the virus, and the virus may have run its course without symptoms in many people. Remember that 90% of the people, approximately, that are infected with the virus are going to be fine. They may have some mild symptoms, but 90% of the folks are not going to necessitate hospitalization. It's that 10% that we worry about, as those tend to be generally older, mid-50s or older, and certainly we want to be vigilant about any assisted living facilities, skilled nursing facilities, nursing homes, things like that, and those outbreaks. That has really been the most challenging part of this epidemic in Colorado. If you look at the little over 1,000 people who have died from the virus, and recognizing that all those people had families and loved ones, and even one fatality is one too many. But of those that have died, a disproportionate number have been residents of skilled nursing facilities. So If we look at the rest of the data in the absence of those affected that were residents of nursing facilities, it becomes a much more clear and probably realistic representation of how the virus is behaving in the state. Next slide, please. So we're doing our best to identify hotspots, and these, the county here is divided into 7 equally sized blocks, if you will, or septants, we call them. And obviously with the majority of the population being in the western and northwestern part of the county, that's where we're seeing our most infections or the positive confirmations of those that are tested. And as population is less dense in the eastern side of the county, we haven't had any confirmed infections on that part of the county. Next slide, please, Eileen. So to the best of our knowledge, these are the active cases of the virus. And when someone tests positive for the virus, they are issued isolation orders that basically says, stay in your home for the next 10 days. Don't leave to the extent possible. Stay in your own room with your own bathroom, away from other members of your household. We are in conversation with Tri-County Health Department to tap into their epidemiological and data mapping expertise so that we can have produced for us some richer, more robust visual data that we can share with community stakeholders and certainly in the community, including the number of Elbert County residents that have been hospitalized for virus infection, the number of residents that were in an intensive care unit, and a variety of other very descriptive data points that, again, can help us better inform resource stewardship, resource allocation, and how we're going to progress with informed decisions moving forward. Next slide, please. So what can everyone do? In a nutshell, continue doing what you're doing. Elbert County's been doing a good job of social distancing. Certainly continue with the hygiene, the hand washing, covering a cough or sneeze, trying to avoid touching your face. And by the way, on the individual level, these are evergreen recommendations. So if the virus were wiped out in another couple months, these are things we want everyone to do to limit the spread of any communicable disease, even if it's a cold. At the relationship level, outside of your family, avoid close contact with others. When we talk about things like the limit on gatherings of 10 people or more, we're not at all really concerned with people within the same household. It's people in other households or in the community that ideally we want to do our best job of maintaining social distancing, which is again at the community level, the next bullet point there. This will again probably be some type of evergreen recommendation. I know folks are thinking twice about when all these restrictions are eased about doing things like going to concerts or going to a Rockies game or things like that. So it's just going to take a thoughtful approach. And if you're in that high risk category, if you're older, or if you're immunocompromised, that's going to necessitate some significant considerations, knowing that there's risk involved with that. And depending on your level of comfort with that risk, being in a community setting like that, make your decisions accordingly. And most of all, again, I've touched on this, educating yourself, be aware. We are striving to provide accurate and current information. We do still spend a little bit of time debunking rumor and innuendo, much less so than our last town hall, but there's still some little bit of misinformation out there. So if you're not sure, if you have a question, call us or look at a trusted source online like CDPHE, Tri-County Health Department, Centers for Disease Control and Prevention. Next slide. Okay, I think that's it for me. So I'm going to turn it back to Chris Richardson. Commissioner?
All righty. Excuse me. Excuse me. That was a throat clearing. Just so from the Board of Health point of view, just kind of looking what our role is as the County Board of Health is to ensure that good in this situation, you know, the biggest tool we have is information, and making sure that good, accurate information is getting out to our citizens and the other stakeholders in the county, and making sure we have good information to base decisions on. As Dwayne had mentioned, we also had coordinated for a test site in the county, which is, I would say, a coup, and thank you to Dwayne and Eileen and the rest of the staff that worked to make that come to fruition. We're one of 50 test sites in the state. The state goal was to have one per county. Some of the larger counties have more than one, obviously, so we have that test site, and in that case, we're meeting a goal of the state, and we're well ahead of at least a dozen or more counties that don't have a test site internally. The other piece is the information support, the expertise that Dwayne and his public health staff bring to support our other local government agencies, the towns, the fire districts, the schools, those that don't have a dedicated public health component. And then information wise is, and again, Dwayne had mentioned this, just coordinating with our neighbors. Tri-County Health has some very robust information tracking that we definitely hope we will be able to tap into. When you look at the numbers that the state makes available easily to everyone, we see about 100,000 folks in the state have been tested, 20,000 have tested positive. As Dwayne mentioned, primarily the folks being tested are those that have clear indications of COVID-19, or they've been in close contact with somebody who's positive. So if we assume the same within the county, with 44 positives, that's 20% of the tested, we still haven't gotten to the testing we want to see. But if we can expand on that data from other sources, Tri-County can, we're hoping to provide some of that kind of acuity data. How many of those 44 tested wound up being hospitalized? How many stayed at home? How many were not symptomatic, but they were a spouse of somebody who had tested? They went in and tested and found out they were positive. So right now we don't have a clear picture of what the acuity levels are. We've looked at, you know, when you look at the testing goals of less than 5% positive, again, if we're tracking state, 20% of those tested are positive. So that's not where we want to be, but until testing is opened up beyond those that are symptomatic or thought to have it, those numbers are going to stay high. When you look at you could just comparison to some of those state numbers, the county has about 0.5% of the total population of the state. So 0.5% of the population, we got about 0.2% of the positive cases. So, you know, under that, if you were just doing strict averages, well under that state level. Tragically, 1.1% of the deaths, but again, well under what you would expect if we were just doing a straight average. Just for context, our county loses approximately 140 citizens a year from all causes of death, whether it's accident, illness, otherwise. So the state's recorded 199 outbreaks in congregate living facilities, whether it's nursing homes, jails, and I believe that number may include the meatpacking plants and outbreaks in some of the businesses. None of those have occurred in Elbert County, though we do have a jail in there. There are two skilled congregate facilities, one in Samaritan in Simla, and Pearl Living, Assisted Living in Elizabeth. So keeping good contact with those folks. As I said, working on getting better data all the time. We did, as Dwayne mentioned, we've submitted a waiver for the county. We're one of 17 that have submitted. 2, Mesa and Eagle, were actually submitted and approved prior to the Safer at Home order that set up the approval mechanism. The first county since Safer at Home came out gained approval was Sedgwick. They submitted on the 28th of April. They were approved either yesterday or today. It said that was Sedgwick County. They've had 0 cases. So, and then when you look at our case rates, again, we're accumulating numbers over time. That was expected. We kind of got through the curve flattening portion, but the expectation that, you know, large numbers of the population would come up positive for COVID over time is still there, absent a vaccine, which those do not happen overnight, and no effective widespread treatment. I think the expectation is this will spread ideally slowly, enough to be able to maintain our medical capability throughout local, state, and national level. Again, we are in a good position in terms of medical support. Certainly our local EMS teams are tremendous. And then, as I said, we're about 0.5% of the population of the total state, but we're surrounded by El Paso, Douglas, and Arapahoe that together have about 30% of the population of the state, and the hospitals to support that much larger population. Good majority of our folks go up to Parker, but you got portions of the county that would go out to Hugo perhaps, and down to Colorado Springs or other Sky Ridge, others in Castle Rock. So there's lots of capability around us, and on a statewide basis, there's weekly reporting of anticipated both bed shortages. ICU beds are not have very regularly over the last month projected no ICU bed shortages. Overall hospital capacities of the 85 in the state, it's generally been about 3 that were looking at capacity issues, and 4 to 5 that perhaps had PPE shortage issues. But I think at the state level that's being worked in order to cross level or divert patients if need be. So where we're sitting now is we know a lot about our county. We're learning more every day about the prevalence of COVID, where it is, and we know that the state has limited resources, and they are focused on the hotspots on the state. They're focused on the high population areas and where the highest numbers of hospitalizations and deaths have occurred, and that is their role. That's what they should be doing. So our request with the waiver, if folks have not actually read the content, isn't a blanket, we want to remove all restrictions. We know that's not wise, but it's to provide the authority to look at local data, local situation, and then on either a regional look, by business type look, by type of gathering look, what are the appropriate measures to take within Elbert County to slow or contain any spread. So that's kind of where we're at. We're, I guess, cautiously optimistic at the moment. I don't think the state initially said they'd turn around waivers in 3 days. That seemed pretty aggressive. 4 to 5 seems pretty aggressive when it's been, I would say, 15 days since a county that had no cases submitted a waiver. But we're ready and postured to answer any other questions that come down from the state. Because again, I think it is a partnership. They have capabilities we don't have. Dwayne is in constant contact with them, probably more times a day than he has time for. But we have a good partnership in terms of the information we can get from the state, what we share back with them, Tri-County Health, our internal agencies, and just that really clear-eyed look of what is right for our county is what we're trying to provide. And I think just one short story, I'll pass it over, but I know Dwayne had called the state to discuss brandings. Most calves are less than 6 feet long, so it's hard to put 2 people on a calf and maintain the proper social distance. And the answer received was, well, you clearly don't need a waiver for that. That just makes sense to make sure they're doing the best they can, what's right. Which kind of begs the question of, if it's common sense and we have that and we have a view, then, perhaps as we build on that, the authority will be granted to do the right things for our county. And part of that is there are broader public health concerns than COVID. It's certainly dominating everybody's thoughts in the news. But just looking at, we have other figures, the calls for service to the sheriff for domestic violence and suicide are up 18% for March and April of 2020 over 2019. And the longer that people are impacted through the safer at home orders, potentially being out of work, the more you're going to be seeing the impacts of that. We've seen some drops in reporting of child neglect and abuse, and I think we'd all love to believe that that means that there's less happening, but because children aren't in school, they're not being seen regularly by other folks outside the homes. There's a very high potential that there could be more of that going on, but we don't see it because those children that may be in danger or adults or seniors that may be suffering from the same are just not being seen or contacted as much by others. So there's a broader picture we're looking at. Obviously, COVID's the priority, but appreciate all the work that Dwayne has been doing, the others that are on the line tonight. I know everybody has been pushing forward in the same direction on this to get eventually ourselves back to at least a near normal. I don't really like the new normal term, but near normal would be better. But with that, I'll pass it on to Megan, and then to, I guess, TJ next, and then we'll open it up for questions. So thanks. All yours, Megan.
All right, thank you, Chris. And thank you all for having us tonight. I'll make it short just so I make sure that everyone who has questions gets those questions answered. As far as the town of Elizabeth, currently we are working and coordinating with both the county, our Elizabeth Fire District, and all the agencies, local agencies here. So many of the time between staff and myself, we're on calls, whether it's the county or at the state level. Trying to get as much information as information is changing day to day, even minute by minute for all of us, and trying to figure out how that will work for our communities. The board currently is extremely focused on our business stabilization and recovery efforts. So last night at our current Board of Trustee meeting, we did pass a resolution that is going to waive some town regulations to help accommodate our small businesses. So for instance, we are waiving our permitting process for our signs and fees. We're accommodating food trucks where they were once might not have been, they will be allowed. So for instance, at EBC, they'll be allowed to be parked there. We're waiving some other fees and so forth, just depending upon the scenario. So we're really trying to work with our small businesses to make sure that they have the resources, are able to put out signs, get customers, business in there so that they're still able to operate based on our obviously our health and safety standards. Not only are the waivers, but the town also has on their website all the information, whether it's for state level or it links you back to county level, and that's the townofelizabeth.org/COVID-19. We all are also working with the Chamber of Commerce. They just put out a survey for small businesses. So if you are on the line and you are a small business, please make sure to check that out. All the agencies and towns are trying to look at how we can help our small businesses moving forward. That is basically it from the town of Elizabeth, other than we're just trying to work with a local group of volunteers who have been doing a food drive that benefits not only Elizabeth, but Kiowa. And so they are doing that the first Saturday of every month. So the first Saturday in June, there will be another one. And it's just a drive-through, but all of the food goes to all the local food banks. We have been able to raised over $5,000 that has been going to the food banks and probably have provided at this point close to 80 boxes of food to them. So just kind of keep an eye out between the county's site and the town site and Facebook pages of what we're doing to try to help our citizens here locally. So, but thank you again for having us and allowing us to be on this call.
Well, I've unmuted myself. I was waiting for direction to talk, but I'll move forward without direction as usual.
We wouldn't
So-
expect anything less.
We're right behind you, TJ.
Welcome everybody. My name is TJ Steck. I'm the fire chief in Elizabeth. Interesting, great opportunity for us to speak on behalf of the chiefs of Elbert County. There's 7 fire departments in Elbert County. We all work very closely together. A lot of surrounding partners that we've been working with throughout this process, but on a regular basis too. So honored to be able to represent them. Although I can't answer specific regional questions for them, we'll certainly find out how we can get questions answered if you have any. If we could put our slide up, I have one little slide, just some interesting statistics for us. If you have it, Eileen, I'm not sure, but
You see it? It should be up on your screen, but maybe not.
It's
okay.
still showing the previous slide.
Okay, well, I'm going to stop the share and then I'm going to share again. Just
Okay. And while you're doing that, Eileen, and
kind of a mystery for me.
sorry to jump in, TJ, but I did just get a note from Jerry Spear, our Director of Human Services. Just want folks to know that though there's been a drop in child welfare report statewide, we've actually seen a slight uptick in the county. And they're seeing slightly more severe cases as well. So again, just a broader picture on overall public health. But thanks.
Do you see your slide, TJ?
I do, thank you. I pulled some stats for this, just interestingly, just for the month of March and April, and because that was kind of the peak of our experience in the fire service in Elbert County. Although the graphs are a little hard to understand, if we've broken those calls out, on the left would be EMS calls, on the right would be fire-related calls, and then you can kind of see the March and April. We've compared the calls from 2019 to 2020. We have seen in 2020 an uptick in both fire and EMS calls in March, but believe it or not, in April, fairly significant drops in both. So we didn't expect that completely with a stay-at-home order. We did expect an increase in calls. What I can tell you about these types of calls, and I can tell you what we've determined through the drop, or trying to figure out why it dropped. The number of EMS calls have changed. We're transporting more patients right now that have shortness of breath, illness related to or suspecting or consistent with a COVID patient. But we're not transporting the heart attacks, the strokes, the motor vehicle accidents, the things, we're not transporting as many of those. Worries me a little because those calls have dropped off. I'm assuming, and our hospitals are telling us that they've seen that drop because people are afraid to go into the hospital to get treatment. The problem we have with that is that as people are not, are avoiding hospitals or avoiding calling 911, they're actually having to call us when the situation is much worse. So we suspect over the next few months, as this thing starts to ramp down, as we all kind of release the reins a little bit, start to go back to normal life or as normal as it can get, we do suspect that those call types will go up. And that's one of our concerns, is our normal traditional calls may increase over the next couple of months back to the normal 78 to 84 calls from EMS calls per month. But we could also see
you froze, DJ. I wonder if
Oh no, we lost TJ.
If you are out there, TJ, if you could try muting yourself and bringing yourself back, maybe you can jumpstart the.
Oh, he's back. Is he back?
Oh, okay.
Well, maybe not. Oh, he's dropped off and he will probably rejoin us at some point. But why don't we go, while we're waiting for him to come back, why don't we go ahead and see if we can take some of the questions that we've received. So hold on just a second. So one of the questions that we've got here is about restaurants and churches and 25% occupancy capacity at dining restaurants. So Dwayne, would you be able to speak a little bit to the issue of what the waiver request to CDPHE might contain and whether or not people can expect restaurants and changes in their experience at restaurants and businesses?
Sure. So I'll take the second question first with regard to the restaurants. And I was just typing an answer in the box. So Governor Polis has stated that on May 25th, his office, along with CDPHE, will be providing guidance on the reopening of restaurants and some other facilities, and what that looks like. No word yet on specifics, whether that, for example, might be 25% of restaurant occupancy or 33% or some percentage of the fire marshal occupancy number. For example, if a restaurant was rated for a safe fire occupancy or safe building occupancy of 100 people, just in round numbers, maybe 25 people. But that's going to be specific to allowing for social distancing of, for example, the dining area. I would speculate that probably there's going to be more availability on restaurants that have outdoor seating, because that has certainly a lot of benefit with regard to mitigating community transmission with increased airflow and things like that. But he has stated that he would like to see restaurants reopen in some form or fashion by the end of the month, meaning May. So we are currently working on some guidance for restaurants on what they can be doing in the meantime to prepare for reopening. And we are looking to push that out in the next week, just as kind of a heads up and things to be thinking about, like flushing your soda lines and your water lines, and coming up with a plan on how you're going to assure social distancing, and perhaps for the line staff in the kitchen, a certain person preparing meals only does one type of thing or one type of meals, and another person does another type of meal, so that they're not constantly running back and forth in close proximity getting ingredients or other operations related to preparing the meals. So hope that makes sense in some fashion. But our environmental health specialist, Stacy Reinhardt, will be pushing that information out to her restaurant contacts in a week or so, if not sooner. So, and then the other question was, I may have typed an answer to it. I don't know if everyone can see it. Oh, the other question was, what is the waiver? What's all included in the waiver? In a nutshell, what's included in the waiver is the ability to make local decisions on variances from the executive order and the state public health order with our more local understanding of the circumstances and conditions related to that request, as opposed to having a blanket order from Denver or some state agency that doesn't have the local context and things like that. So that may be related to, allowing for an additional number of folks beyond the current executive order of gatherings limited at 10. I have heard in a couple conference calls with the governor in terms of easing restrictions. I have heard him mention the number 25 a couple times, and how I would anticipate this unfolds over time. Remembering that the decisions we make today are going to affect the community about 4 weeks from now, and we'll have actionable data over the next 4 weeks, I should say. We'll have actionable data after 4 weeks, so that at the end of June or mid-June, we will be making decisions on the downstream effects in mid-July or late July. So understanding that the virus can take as long as 14 days to run its course, and then we need a couple weeks worth, certainly, of data on infections and other things going on to make those local decisions. So it's safe to, at this point, to assume to look at this in kind of 4-week increments, I think. That's kind of an educated assumption based on some of the comments I've heard, or an informed assumption. So if at the end of May, the governor says, we're increasing the number of folks that can congregate from 10 to 25, and then we take another 4-week windows look at it, and it might increase from 25 to 75 or whatever that number is, and hopefully progressively growing in number over time. Conversely, if the numbers and the data dictate that we need to dial things back, the governor has stated that he will do that. So I know that's not something a lot of folks want to hear, but that's the reality of the situation. And just sharing the governor's comments in that regard. So
we have Chief Steck back with us. Welcome back, Chief.
Thank you. I'm not sure what happened. Now I'm on my laptop.
Would you like to reshare your slide and finish your comments, or?
You don't have to put the slide up, and I'll jump in at any time. Sorry about the technical stuff. A couple of things I do want to share. Our foundation's been great. I wanted to thank the community for the donations from the foundation. They've actually given out over $18,000 to our local businesses to keep them afloat, or to help keep them afloat, which has been very helpful. We've got a lot of help from IREA, Farmers Insurance, Shelter Insurance, Walmart. And then, of course, we applied for some of the COVID relief funds through the state to help them out. So we were lucky to get that done. So if you're interested in helping the foundation with that, you can go to elizabethfirefoundation.com, and there is a place where you can either apply for assistance on there, or you can donate to the fund as well. From here on out, what I wanted to let everybody know is our strategic planning process was going like gangbusters through the first quarter of the year. And then, of course, we have some changes to make now. We have some upcoming looming issues regarding residential assessment rates and how property taxes are going to be collected because of this. So we'll keep an eye on that. We are financially stable right now, and we're going to start making some cuts this year, halfway through our fiscal year, so that we can be even more ready for the 2022 period, which is when most special districts will see the hit financially from this situation. I know that counties and towns rely a lot on sales tax. They're seeing the hit now, and we plan to do that in the future. Wanted to remind everybody about our wildland season coming up in the southern end of the county. It is here. They are very dry down there. A couple of agencies today have run brush fires already. So, help us out with that and make sure that your properties are mitigated and we're not starting any fires. Make sure to get burn permits and have inspections for those campfires. We thought about stopping campfires countywide during this, but then we realized that was probably a pretty good bonding moment for folks to get outside and do their thing. So we left that alone. We need a little bit of help from all of you in the community, not only with the wildland stuff, but just keep doing what you're doing. Like Dwayne said, keep separating when you can, and wear your masks if you believe in the masks. Wash your hands. Do the stuff to keep our firefighters safe. Most importantly, though, be careful and don't get in car accidents. If you're sick and you don't feel good or you're having chest pains, call us. We'll come get you and we'll take you to the hospital, and we'll make it just as normal as we can. So don't want to take up a whole lot of more time, Eileen, with that. But if anybody has any questions for us, I believe I'll jump back on my desktop, but I have the laptop up and I can help answer questions if there are any on the fire side.
Great. Thank you so much, Chief. We appreciate your being here. So we're running close on time, but you all can see some of the questions. I don't know whether Chris wants to wrap up.
Yeah. Well, I was going to say there's a few questions that have come in that I think I can wrap together a little bit along with a comment. And there was one, Jen asked what businesses closed with businesses closed in the county and our citizens being forced to drive out to support big box stores. When are we going to let these folks open back up fully? And there's a few other questions related. I really do encourage folks to look, very carefully at what the restrictions are right now. I know we get bombarded with Denver media. There's lots of large populous areas that have put higher restrictions in places. Currently within the county, the only businesses that are operating under major restrictions, I would say, are restaurants that are not allowing dine-in service, but are still mostly doing takeout and delivery. Bars for drinking in bars. There's some I see across the street from the county building. The Kiowa Bar delivers. That might be their kitchen. It might be their drinks. I don't know. I haven't checked it. And then gyms are generally closed to regular operation, but personal trainers are acting there, and I think there's been some guidance given to specific local gyms on general operation. But those are the only ones that are really operating under any severe limitations. So if there is a local business outside of dining in, drinking in, or working out with a big group of friends in a gym, those businesses are open. I'd encourage you to frequent them. There's some questions specifically about the details of the order. I really do encourage you to read them. It's easy to give a synopsis and leave something out because there's about 15 pages of text in there. But as Dwayne said, it is primarily a request to start at the baseline of the state orders and then reduce restrictions appropriately based on our local data and local situation. So we can get there faster than the state. I know I'm as disappointed, and I think we all are. I know the governor came out early in the month and said he'd like to see restaurants opened in some way by mid-month. Well, we're mid-month, and now we're talking about guidance coming out on the 25th to potentially get open by Memorial Day. And I think what you're seeing truly is a state government that is overwhelmed and trying to manage the eaches of 64 counties and an unknown number of municipalities, and those that just have the ability to track their data better than the state ever can because they'll be overloaded. So we are working within the state guidance, that we are a political subdivision of the state. Our authorities come from what the state grants us. We are working at, as we should within those state authorities to see what we can do that's right for our people. And we'll keep pushing the state on this waiver. We'll work with them to get to where we need to be to do the right things by our citizens. At this point in time, that's the right way to do this. It's unfortunate to see that the results of some folks that have made the bold, I mean, they have made that personal choice to step forward. And unfortunately, in the case of some of the restaurants we've seen around the state, they've been slapped back very hard by the state. The state holds licensing authority on many of those operations. Whether the county approves or doesn't approve, we can't preserve that license, even if somebody were to choose to open up doing everything right. If they were opening up absent the state authority, the state can use their authorities to strip liquor licenses and other licensure for other professionals. So we are working within the framework that we are working in to get ourselves back as near to normal as we can in a way that reduces the risks we can reduce, and do not put our citizens or our businesses in a position where the state can take action and we have no way to support them in that action. So that's kind of where we're at. There's generally a lot of good news right now in terms of the direction this is heading, in terms of spread of COVID and impacts in our county. And I think everybody on this call, on the panel, and everybody that's joined this, is there are frustrations. I mean, we certainly cannot sit in our homes forever. There's a point where preserving quality of life is a strong or stronger aspect than the impossibility of trying to preserve every life. We knew from the beginning, and it was stated from the beginning, that measures were being taken to preserve our medical capability, but that it was expected that until or unless a vaccine was developed, that essentially everybody would eventually contract COVID. So we're kind of in that position now, and our medical capabilities are strong. I'm thrilled. I know that our local fire districts were expecting by this time to be well down in their EMS capacity, because they truly expected that there would be infections within those crews. And very thankfully, grace of God and good training and good leadership, that has not happened. So locally, that has been preserved. The fact that we haven't had any outbreaks is a tremendous compliment, and speaks tremendously to the folks that are working in those two assisted care facilities in the county and within our jail. We did have one inmate that was passed briefly through the jail that tested positive. He was had been housed in Douglas County, was returned to us. And we found shortly after he was returned to us that his bunkmate was positive. But again, that was handled in a way that none of our deputies nor other inmates were impacted. So there's a lot of tremendously good work going on in the county. I do appreciate every step that every citizen is taking to protect themselves and others. Just stay aware. If you have questions, please do reach out. We're doing our best to answer them, and we're doing our best to get ourselves back to as near as normal as we can safely. So that's kind of my closing comment. If anybody else has anything, please feel free, Dwayne or TJ. I'm not sure if Megan's still on.
She is still on.
Okay.
And we're about 4 minutes over, and so I just wanted to see if anybody had any final comments.
I have been trying to answer some of the questions that popped up in the chat box. If I didn't get to your question, please feel free to connect with me at the health department for a conversation. And thank you all for attending tonight. And please wear your masks when you go out and practice social distancing. And we look forward to seeing folks on the next town hall meeting down the calendar.
Mayor, Chief, do you have any final comments?
I really feel like I should go after the mayor.
Probably a smart decision on your part.
Right. I know that there was a question that had come up about, the local businesses. I would encourage everyone to check the chamber site. I have worked with the chamber and we've created a list, especially here in Elizabeth, and we've tried to include Kiowa and Elbert as far as their hours, how they're operating, and we try to update that as new information comes in. But the town is working hard for our businesses and will continue to do so on our citizens. So, but thank you very much, and I look forward to being on the next one.
Thanks so much for being with us tonight. Chief?
Well, everybody stay safe. I did want to point you out to our YouTube channel, Elizabeth Fire Rescue. Just do a search under subscriptions for Elizabeth Fire. Our firefighters have been reading kids' books for the kids. If you have little kiddos at home that need something to do, it's kind of entertaining. It's even entertaining for the adults to watch these guys. We're running to burning buildings, but you put them in front of a camera and they're shaking like a leaf.
That's fantastic. We're so happy to see so many of our first responders really stepping up in those kinds of ways to connect with the community. It's really reassuring.
Very cool. And the one comment I was going to make from everybody here is what we have seen in our county and our communities. There are a lot of people pulling together right now, a lot more than we've seen in the last couple of years. So I'm proud of everybody for that. I appreciate it. We're seeing a lot of solidarity among our community. So that's very cool. People waving at each other, stopping and talking on the street while they're out walking. So stuff that we kind of forgot about. So let's keep that up and let's be nice to each other and take care of each other as a community.
Well, thank you for that. I appreciate it. And I appreciate all of you all being here tonight, as well as our 20 some odd participants. It's a fantastic number for us for a town hall. And we will look forward to the next time we all get together. Thank you all for being here tonight. Have a good night.